long-term efficacy of SLT in Indian eyes with primary open-angle glaucoma and OHD observational study.
Good afternoon everyone. I'll be sharing our long-term 4 years follow-up of SLT in Indian pigmented eyes with primary open-angle glaucoma and ocular hypertension. As we all know that the medical line of management for glaucoma is the gold standard, but the side effects of medications are a major concern, as we can see in this picture. And the most common problem is the non-compliance. About 10% of the patients go blind because of the non-compliance. Another option is laser trabeculoplasty. Though argon laser trabeculoplasty, which became very popular in the late 1990s, but it is known to cause a coagulative damage to the trabecular meshwork, which may limit the efficacy of further non-surgical therapy. So the SLT, which is a cold, soft laser, developed as an alternative to ELT. SLT uses a Q-switched frequency double Nd:YAG laser, which works at the wavelength of 532 nanometers. The heat energy from the laser quickly and selectively targets the pigmented tissues in the trabecular meshwork without causing any thermal or coagulative damage. Causes recruitment of the macrophages to the trabecular meshwork, which removes the obstructive proteins and other materials. Hence, it improves the aqueous outflow and reduces the intraocular pressure. There has been many studies which have been conducted in the Western population, and they have shown that IOP reduction of 15 to 30% has been reported over 3 to 4 years. And also, SLT can be used as an adjunct which can reduce the number of medications. Many studies have been done in the Western population and in Caucasian eyes, which have shown the efficacy of the SLT as a long term, but in Indian pigmented eyes, the long term efficacy of SLT is still not known. Hence, what's the long term efficacy of SLT in Indian pigmented eyes, and what about the failure rate? There's not enough data in the literature providing long term effect of SLT in Indian subset of population. So to answer these questions, we went ahead to perform a long term efficacy of selective laser trabeculoplasty for lowering the intraocular pressure in pigmented Indian eyes with primary open angle glaucoma and ocular hypertension. It was a prospective interventional case series where 158 eyes underwent SLT and 55 eyes have completed 4 years of follow-up. Our inclusion criteria was primary open angle glaucoma cases and ocular hypertension cases who are newly diagnosed or currently controlled on medical therapy. In 44 eyes, SLT was done as an adjunctive therapy, and in 9 eyes, it was done as a primary treatment. These cases were excluded from our study. So, the washout period was observed 2 to 3 weeks depending upon the drug, and during that period, the IOP was controlled with the oral medications. And in SLT, by default, the pulse duration is about 3 nanoseconds. The spot size that we used was 400 microns, and the energy range is between 0.6 to 1.4 millijoules. And around 100 laser pulses were given around 360 degrees, and the presence of cavitation bubbles were our treatment endpoints. Then post-operatively, NSAID eye drops were given for 2 to 3 days. The effect of pilocarpine was reverted by giving a drop of Tropicacil. IOP was checked with applanation tonometer 1 hour, 24 hours, 1 week, 1 month, then every 3 months till 1 year, and then yearly. Disc and field examinations were performed every year. Our outcome measures were IOP, which was measured and compared pre and post SLT. Percentage reduction in the IOP. More than 15% reduction from the baseline was considered as a successful treatment, and reduction in the number of glaucoma medications pre and post SLT. These are the demographic data where 55 eyes were recruited who finished 4 years of follow-up, out of which 46 eyes had primary open angle glaucoma and 25 eyes received bilateral SLT. So the results showed that the mean IOP reduction was 17.2% from the mean baseline IOP, that is 19.06 to 15.78 at 4 years. And there was significant reduction in the number of medications from 1.5 to 0.81. So the reduction in IOP was associated with reduction in number of medications at 4 years. And percentage of eyes showing more than 15% of reduction in the IOP from baseline was more than 51% of the eyes, though the effect was higher at 1 year and 2 years, but it was stabilized and maintained till 4 years. Looking at the drug profile, 62% of eyes were off the treatment at the end of 2 years, and by 4 years, 47% of the eyes were off the treatment. So it is possible to stop medications on 47% of the eyes by 4 years. SLT was done as a primary treatment modality in 9 eyes, where all eyes in all the eyes, IOP was controlled without any failure till 4 years, and there was 22% reduction from the baseline. Now the failure rate was 12.7%. Repeat SLT was performed in 4 cases after 1 year because the target IOP was not achieved in those cases, and anti-glaucoma surgery was done in 3 cases because the visual progression was seen in the visual fields. So, and results of our study was compared with other studies. Though the effect of SLT wanes off at 1 year, after 1 year, but it attains a plateau and the effect is stabilized and it can be maintained up till 4 years. The limitations of our study, it was a small sample size and there was lack of any control group. The credentials, it is the first study done in the Indian population with such a long follow-up of 4 years and establishes the role of SLT as a primary line of management in glaucoma cases in Indian pigmented eyes. So to conclude, more than 15% reduction was observed in more than 51% of the eyes over 4 years, and at 4 years, more than 47% of the eyes required no medication and the maximum effect was achieved by 1 year and then the effect was stabilized. So the take-home message here is, SLT is a good option as a primary or adjunctive therapy for mild to moderate open-angle glaucoma cases and ocular hypertension. So it is a safe, effective and smart option in pigmented Indian eyes. Thank you.
Do we have any? Thank you, Doctor. Since there is one more session left, we'll soon close this. Thanks for the